races. We were looking at Florida, we were looking at Ohio, we were looking at control of the House. Those were the big issues last Tuesday. Was it just last Tuesday? Yes, right? Just last Tuesday. Time flies, right? But I think there were three fascinating races, is that in Utah, Nebraska, and Idaho. These are like redder than a beet state. These are really, really red states. They voted to expand Medicaid. And they voted, you know, it was sort of they voted pretty easily. These are really conservative states that have conservative governors and conservative, they didn't flip the legislature. They didn't change their elected government. The government looks the same in those states. But they said to that government, I know I'm voting for you as a Republican governor. I'm voting for you as a Republican state rep. I'm voting for you as a Republican senator. But I want Medicaid expanded in my state. And part of it is an economic argument. I mean, if you're paying, this was what Jan Brewer, who was the governor of Arizona a few years ago, very, very conservative, but one of the first Republicans to endorse Medicaid expansion. She partly made a moral argument, and she also made an economic argument. She said, we in Arizona are paying tax dollars to Washington, and they're going to go to some other state. Let's expand Medicaid and bring them back here. That was part of the message in some of these states, but it was also, again, a fairness argument. I mean, Americans are really, they're you know, all over the place on health care. They want coverage, they want affordability, and they basically, I don't know that we as a country have really gotten to the point where we agree that health care is a human right. I think in this room probably people think that. I think if you phrase it that way, it would split nationally, and yet there's still people who might not use that language of right, still sort of have this gut sense of fairness, of rightness, a difference between a right and just something that feels right. And I think people don't like the idea that you pay insurance and you get sick and you're not covered.